real honor to stand here with the governor, with the senator, with the mayor, with the doctors, with the people who fight for health care here in the Commonwealth. I am grateful for that, and I look forward to the fact that when we partner up, that's how we make real change. So last week, the House of Representatives passed Donald Trump's big, beautiful bill. This would be the greatest transfer of wealth from just one piece of legislation from the poorest Americans to the richest Americans ever before in U.S. history. Think about that. These guys are actually out there making history by taking away from hardworking families, from people down on their luck, from seniors, from little babies, so that a handful of billionaires and corporate CEOs can get more giveaways from the government. That is the Republican plan. Billionaires win, everyone else loses. Now, the details are gruesome on this bill. This bill would cut Medicaid, gut the Affordable Care Act, and slash food assistance. If it passes the Senate, this bill will rip health care away from 14 million people, over 250,000 right here in Massachusetts, all to pay for handouts to billionaires. This Republican bill will raise costs for working families, from groceries to health care to utility bills, while making the richest Americans even richer. Here in Massachusetts, the consequences will be severe. In our state, Medicaid is known as Mass Health, and it covers almost 2 million people. If this bill passes, every one of them will be at risk of losing their health coverage. That is 1/3 of all newborn babies and their mamas right here in Massachusetts at risk for losing their health care. That's checkups and trips to the doctor for ear infections and money for asthma medications and for antibiotics for more than 1/3 of all the children right here in Massachusetts. That's paying the monthly bills for almost 2/3 of all nursing home residents right here in Massachusetts. As the governor said, the pain will echo through our communities, hitting even those who don't currently receive direct care. Without the guaranteed payments from Medicaid, our hospitals and our community health centers are at risk. Community hospitals, even with Medicaid reimbursement, are already struggling. And right now, nearly half the funding for Massachusetts community health centers, which saves money by preventing people from needing to go to the emergency room, half their money currently comes from Medicaid that is on the chopping block by the Republicans. When those hospitals and community health centers are forced to close, we all lose. Now, right now, you probably know someone who counts on Medicaid to pay for the medicine that helps treat their cancer. You probably know someone who got the hip replacement they needed so that they can walk, paid for by Medicaid. You probably know someone whose kid gets their inhaler from Medicaid, or the nursing home that takes care of their aging parents. And all of those are at risk. This is a full-blown crisis, and we are here to sound the alarm. I'm here with Governor Healy and with the senators and everyone behind me because we believe that no one in America should go without health care so that Elon Musk can take a rocket ship ride to Mars. We believe that no senior should be kicked to the curb because Mark Zuckerberg wants to buy another Hawaiian island. And we believe that no one with a disability who needs a home health aide should have to give that up so that Jeff Bezos can buy a third yacht. We believe that, and that is why we are here to fight back. I am proud to stand beside the governor and beside the senators, beside the mayor, to make sure that everyone in Massachusetts and around the country gets the health care that they deserve. And with that, I will turn it over to a